Well, we're here with Dr. Theocharides. Is that right, Dr. Theocharides? Do I pronounce that right? I do.
Yes, indeed. People call me Dr. T for short.
And I would like that myself, Dr.
All
T.
Right.
Dr. D in Ocean in New Jersey. Dr. D, you do lots of cosmetic surgery. You make people looking better without the huge, plastic surgery type of stuff. Tell us a little bit about, give us a little bit about your philosophy of like how you go about that and, what methodology are you applying? Because there's so much out there which apparently makes us young, some does. Give us a little rundown of what your practice does.
It's really an exciting time to be alive with the new technologies. There's so much we have to offer to make skin look more youthful, to take 5-10 years back on a person's appearance, whether it's their face, whether it's their body, with really no downtime or minimal downtime. My specialty is in the non-invasive, non-surgical procedures. When we're looking at the face, we're talking about things like the simple things like Botox and fillers, lessening the appearance of wrinkles, filling in the loss that happens in a woman's or a man's face. Skin, a very common complaint are wrinkles. We have the highest technology, the high-tech lasers that will provide wrinkle reduction with really very little downtime. Sun damage, the dyschromias when people have the brown spots and so forth from excessive sun. We can turn the clock back by using procedures like photofacial. That actually has zero downtime. People get this done in their lunch hour. Other procedures such as microdermabrasion, which is just a deep cleansing of the skin, almost like a deep cleansing facial without the chemicals. That's something that can also rejuvenate the skin. We have everything from minimal procedures that will help a little bit to things that can make a dramatic 5-10 year or more improvement. Our motto is we help beautiful people look more beautiful.
Wow. So basically what you're telling me here is that the technology has advanced to a level where we have a little bit more, not that creams also are bad and don't do anything, but we have a little bit more than the cream thing. We can get results faster, but we still stay away from the knife and from heavy chemicals. Is that what you're saying?
That's correct. And the thing is, when we combine procedures, and I had the pleasure to train internationally with some of the biggest names in cosmetic surgery from Canada and other areas, and when we combine Botox and fillers with photofacial and then laser peels, the whole benefit is really bigger than the sum, so that you can actually literally take a person back 10 or 15 years without actually using the knife.
Well, and I guess that's really, appreciated, because even if it's just a small little needle or going to a dentist, or none of us really likes the knife. And I don't think the body, it should be kept away from a knife as much as possible. But if you can somehow restimulate, tighten the skin, make it look, more youthful, more vibrant, without any of that, that's absolutely wonderful. Well, we're going to talk more about it, on how you go about it with particular procedures and what they do, but it's nice to know that those things can be done. And most of those things, what you're saying, they have no downtime, meaning a person doesn't have to stay away from work for 2, 3, 5 days or longer, doesn't have to go to the hospital. It's like an office visit or several office visits maybe, but not much different than going to a dentist or to a chiropractor. You walk out and you start looking better. Is that what you're saying?
That's correct. And all the procedures that we do are done in the office under either no anesthetic or some local anesthesia.
Wonderful. And on an average, I know we have many procedures and there's many situations, but on an average, how much time does it take to have the neighbor look, realizing that you look better, but he doesn't at the same time say, oh, you had plastic surgery, you got, something like that. How long does it take? 1 visit, 2 visits, a month, 2 months, 5 months? What are we doing?
Very good question. It really depends on what we're going to have done. For example, a person who comes in and gets Botox. Well, we used to say Botox. Now we call it neuroblockers because there's more than one option available. We have Dysport and we have Botox right now. And there's a third one that's actually coming into the area, probably to be approved next year. So this is an exciting time. That really takes 10 or 15 minutes. The actual treatment, getting your Botox injection, literally takes 5 minutes. Minimal discomfort. We use very fine needles. Now, once a woman has that, she will not notice an improvement immediately. It takes anywhere from 5 days to a week, maybe 10 days. And there's a gradual lessening of wrinkles. The beauty of that is when she sees her friends and her neighbors, they'll look at her and they'll kind of wince and wonder, what is it about you? You look so rested. Have you been on vacation? And so it's really not an obvious improvement, not obvious that something's been done, and yet the client will definitely notice an improvement in softening of wrinkles.
Well, that looks like the ideal thing. So on an average, it's going relatively fast and gradual.
The other thing, for example, if a person has fillers, now fillers, whether we're enhancing lips or lessening depressions or adding some cheek augmentation, all those things with fillers, the results are immediate. Before you leave the office, you will notice a dramatic improvement. Now, there may be a little bit of swelling. Bruising is quite uncommon. That may take a couple of days to resolve, but certainly that effect is immediate. And again, no downtime. Wonderful.
Very beautiful information, and definitely, as you kind of say, it's exciting. We can actually, there's many technologies in healthcare which make us living longer, and obviously, we want to be not just live longer and look ugly and be in the bed and be, so now we can also, we can live to 100 and still look good. Wonderful, absolutely wonderful. Thanks a lot, Dr.
Right.